Today, Teeny and I left the doctor's appointment. Nothing changed, but there was something that I left feeling pretty good about. Just want to take a few minutes to talk about that. Bear with me, I ain't reading from notes, but I thought it was important enough to read what I wrote down. That way it's kind of brought across better. So, I bet this may sound unusual, but I left with the same trach and the same feeding tube I arrived with. Procedure was normal. Nothing medically changed. So why do we feel encouraged today when we left out of there? I mean, we walked out, I was like, man, that was a good appointment. Biggest thing was the doctor that changed out my feeding tube, my regular routine, and a dietitian that we spoke with. They was overly kind, caring, and just plain old nice. It's very refreshing when healthcare professionals are nice. I understand everybody's busy, but whenever you're a patient and you're going through these things, it means the world. Plain the kindness, the genuine care for my treatment goes a long ways. For years now, I've been navigating this healthcare system. I've had cancer, I've undergone radiation treatments. I've had this trach now since 2024. Feeding tube's been coming up to a year now. I've met literally hundreds of healthcare professionals along the way. They had to schedule a feeding tube change out with, and it is my dietitian. Both professionals were caring and patient. Tina and I walked out, talking about how good the appointment felt. Not because of some medical breakthrough, but because of how we were treated. As patients, we don't walk in appointments as blank slates. We bring anxiety, uncertainty. Some patients worry about test results, and others worry about finances. Some worry about whether they'll feel normal again. Healthcare professionals have the opportunity in a few minutes to either increase anxiety or reduce it. Many don't realize how powerful this opportunity is. I don't remember every medical instruction I've received, but I absolutely remember how many people made me feel. I remember the providers who showed me compassion, the nurse who took the extra minute. I remember the doctors who, instead of standing up, would sit down in a chair and talk to me. They're not in a super hurry, but it takes time. Treat you like a human being rather than a problem to solve. Patients may forget what you said, but they rarely forget how you made them feel. From one patient who spent a lot of time in the healthcare system, thank you. Kindness may not be taught in every classroom, but may be one of the most powerful tools a healthcare professional possesses.